We're the team from Calgary Zone, and it's a partnership between Alberta Health Services and also Verve, Prince of Peace. I think what we've realized in this work is that patients have a different understanding of safety from healthcare providers. And so what I have found through the work of the MMSF and using it in other contexts is that when patients and families talk about safety, they're talking about personalized care, specific to their person in care. Things like, is her favorite shawl on, or is her hair done the right way? And so when clients and families talk about safety, that's what they mean by safety. That's how they determine safety, are the healthcare providers able to carry out the personal things that matter to me? And as healthcare providers, when we talk about safety, we're talking about clinical safety. So things like, are the medications arriving on time? Are the medications the right ones for the patients? And so in using the MMSF framework, what's occurred to me is, those different definitions of safety, mean that when you're talking about safety as a provider, and when you're leading those conversations, patients and families are starting with an understanding in a very different place. And so I think using the framework and understanding that means that you can move that conversation into a different sphere.
So at the team level, I think one of the big changes was actually getting comfortable with the language of the framework. Initially, there was a lot of struggle because I think a lot of us came from that quality improvement environment where we knew what the intervention was and what it is we were implementing and how we can message that and how we measure the outcomes in terms of process outcomes, balancing measures. We understood that language. So this was very different in terms of how we use the lens of the framework and how we discuss this with our, at the team level, so at the local Prince of Peace, and even for the case manager and how she discusses it with her colleagues. So that was one of the first challenges that we faced and overcame. And it was great to see everybody in the team get really comfortable with using the language, using the lens of the framework and discussing safety. And then gradually we started to expand beyond the site. And so I think about Lisa, who is the case manager, and how she was able to use the language in discussing with her other colleagues in home care, so the other case managers at the other supportive living sites, and be able to use the language to talk about emerging concerns across supportive living sites. And even Jen, yourself, you talked about how you also started to use the language and the framework in responding to incidents at other sites. And Jen also did a presentation with Leanne to the site lead medical directors, to the seniors, palliative and continuing care portfolio. So this is the portfolio that is the sort of, I would say, operational medical leadership level in the zone. And so we moved beyond the Prince of Peace side, we moved beyond supportive living, beyond your role sort of in a senior quality consultant, and then coming up to the sort of that senior medical leadership in the zone. And what came out of that is that we had our director of quality use the MMS framework in presenting some of the quality improvement initiative, some of the emerging incidents across the zone. So he embedded the language in those quality reports. And at the site lead medical directors meeting, which is the group that has all the medical directors across the zone representing the different long-term care organizations, we also embedded the framework in terms of how we report incidents at sites, physician-related issues, as well as patient-related issues. And so that's the way in which we were able to move the MMS framework from Prince of Peace move it up to supportive living, embed it in the workflow of our quality consultants, embed it in the workflow of the home care case managers, bring it up to the site lead medical director level, and then even up to the seniors palliative continuing care portfolio.
I think leadership has been an instrumental part of this, to begin with. When we started and learned that this collaborative was going to happen, it felt, as the people writing that expression of interest, myself and Leanne, the safety consultant, participating in this project felt like such a long shot at that point. But we were able to convince Anne Hannemeyer, who is the director for Integrated Facility and Supportive Living. So within her department, she oversees all of the long-term care sites and all of the supportive living sites within Calgary Zone. So getting her on board and having her realize what an incredible opportunity this was, that was huge for us. So having her support, which allowed us to approach a supportive living site and which allowed us to be able to have a care manager from her department, join us, that was critical in terms of how this project flowed within Calgary Zone. I think having Vivian as well, on board with us as a physician, we've learned today, even over the last 2 days, how critical that physician engagement is. So having Vivian on board to be that physician voice for our project was just so important in getting other site medical leads on board. And then I think the final piece of that puzzle is my own director, Abram. We took him on the journey. He was very new to our team at the time, but I think he saw the potential of this framework to change the type of work that our team was doing, to support, all of the seniors' health departments within Calgary. And so having those 3 individuals on board was so important for our project and has allowed us, to spread the project beyond just the site. I think the other thing that was critical, in the early stages was because we were able to get ISFL on board, we also, through that connection, were able to approach the Director of Care, Mary Rose, at the time for Prince of Peace site. And so she saw the potential of this to change the way that Prince of Peace, cared for their residents. And so, that engagement across the board, really helped us push this project to a very deep and meaningful place.
In terms of the sorts of changes we made, it was really about the mindset and how we approach safety. So we're still doing what we do, but we're doing it differently. We used naturally occurring meetings. So like staff would do handovers and talk about patients, but now intentionally, we have the safety tickets, we have the safety huddles, which is arranged around shifts. And so in terms of sustainability, I think the way we implemented the framework will actually drive sustainability. And when we look at how we've implemented it at the site lead medical directors, what we did was we used the monthly reports by the directors and just embedded the framework in the report. And so the directors still send in their monthly reports, but they use the language of the framework. And then we look at how Abram, the director, has influenced the quality committee and he's embedded the framework. So in terms of sustainability, I think the key was the way we implemented it. And I think we implemented it in such a way that we used existing resources, existing opportunities. We didn't really require any additional resources. And so I see this spreading and continuing to spread across the province.
When I attended the site champion meeting, which Amy has been instrumental in kind of getting off the ground, what I saw is almost all the staff have an equal voice when it comes to safety. It doesn't matter where you're placed in the organization or what your position is. What I saw in that site champion meeting was such an aha moment for me, because I saw every staff member at that meeting fearlessly representing their opinions and telling the group what they thought should be done about whatever safety issue they identified. And so I think that's been one of the transformational moments of participating in this project, is that whoever you are, as long as you're working in a healthcare organization, your voice matters.